We are live, madam. You can start the session.
So, good evening, friends, and all the mentors. Welcome to the fourth season of Brain Teasers in association with OSN, which presents the Big Q. So, this is the signature tune.
आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So, today is the third quarter final of this season, and today's quiz masters are Dr. Archana Kumari ma'am, who is currently working as director head of the retina department in Prasad Eye Hospital, Ramgarh, Jharkhand. Our other quizmaster is Dr. Purvi Bhagat ma'am. She is professor and head of the glaucoma clinic at MNJ RIO Ahmedabad. And our third quizmaster is Dr. Rohit Saxena. He is professor at Dr. RP Center of Ophthalmic Sciences, AIMS, New Delhi. So we all know that this is the third quarterfinal, and the next quarterfinal will be 2 weeks later at the same times. Following that will be 2 semifinals and 1 final. So let's see what is the format of the quiz today. So in quarterfinals, there are total 80 teams, 20 teams per quarterfinal, and today is the third quarterfinal. So for teams, you have to log in through 2 devices, that is Kahoot and the Zoom platform, and every team needs to log in from the 2 devices. So first screen is a live quizzing on the Zoom platform. It will be only for the teams. And the second is the Kahoot platform for the MCQ round. It is for both the audience and the teams. I request all the mentors to log in from a separate screen only on the Zoom platform. So from 20 teams who are playing the quarterfinal 3 today, 5 will qualify for the semi-finals. And the criteria for qualifying for the semi-finals are your respective marks of today's quarterfinal and the total of the best of the 4 performances of the preliminary rounds. So now coming to the rules, format is there will be 3 sets of MCQs. Each set will have 5 questions. It will be played by both the teams and the audience, and there is no negative marking in this round. While the second is the rapid fire round only for the teams on the Zoom platform. It will be the face-to-face round. You will have to answer 5 questions in 30 seconds time. For every correct response, you will get plus 10. While for every incorrect answer, minus 5 will be deducted. If you say pass or no answer, then no marks will be given for that question. So teams who are not playing today's quarterfinal, they can play as an individual in private practitioner category. So these are the prizes for the postgraduates in the finals, and audience prizes are per episode. So before we proceed with the quiz, I would like to thank the His Highness team who has been our partner for this season since starting. Our sincere most gratitude to Mr. Suryanarayanan, Mr. Naresh and Mr. Kaustubh for their support and pushing us to start this season. We would fall in our duties if we don't acknowledge the field force of His Highness who made so much efforts to enroll all the PGs from across the country. I would also like to thank the Numerotech team for the smooth and flawless execution of this quiz years over years or registration, live quizzing and computing of the results and all the back-end work which goes behind every episode and is taken care by the team. So our sincere most thanks to Mr. Sai and his team. So with this, we move on to the quiz, and I would like to introduce our first quiz master, Dr. Archana Kumari. She has done her MBBS from Medical College, Kolkata, and MS from Ramakrishna Mission Seva Pratishthan, Kolkata. She has done her fellowship in VR. She is presently working as director and head of the retina department in Prasad Eye Hospital, Ramgarh, Jharkhand. She is a DNB teacher in Bhagwan Mahavir Medical Super Speciality Hospital, Ranchi. She is the winner of Manjul Pant Gold Medal Award for Best Retina Surgery Video in 2023. She is the author in many of the peer-reviewed publications. She is very enthusiastic speaker and has presented faculty talks in many of the national and international forums. So with this, I hand over the screen to Dr. Archana Kumari.
Thank you so much, Dr. Shilpi.
So ma'am, shall we start?
Yeah. So here, all the team is ready. Shall we start with MCQ? 1. True about Chirpy is option A, it is monofocal. Option B, it's usually benign. Option C, it's always bilateral. Option D, it's diagnosis of exclusion. Your time starts now. So the answer is B, it is usually benign. Chirpy are usually benign asymptomatic RPE hematomas. It can be monofocal, multifocal, and atypical. It is bilateral. Multiple chirpy are usually seen in atypical type and needs ruling out familial adenomatous polyposis. So second question, Mactel true statement is option A, Mactel 1 and 2 is almost always involves both eye. Mactel, option B, occlusive Mactel is now grouped in type 1. Option C, Mactel 2 classified on the basis of multimodal imaging project into 7 types. Option D, Mactel primarily causes peripheral vision loss. Your time starts now. So the answer is option C, Mactel 2, classified on the basis of multimodal imaging project into 7 types. So coming on to the explanation, Mactel 1 is usually unilateral and is associated with microaneurysm. Mactel 2 involves both eyes and is associated with systemic conditions like diabetes mellitus, coronary artery disease. Mactel 2 is classified on the basis of multimodal imaging into 7 types from grade 0 to 6. Mactel always causes central vision loss and never peripheral vision loss. So now the teams gear up for third question. False statement about ocular toxoplasmosis. Option A, always uniocular. Option B, associated with dense vitritis. Option C, may be associated with anterior chamber reaction. And option D, is systemic therapy versus intravitreal clindamycin is proved to be equivocal. This is an easy one. Come on, let's start the time. So I think all have got their answers correct. This is option A, always uniocular. Though ocular toxoplasmosis is usually uniocular, but can be binocular in immunocompromised patients. And it usually presents as retinochoroiditis with dense vitritis, giving headlight and fog appearance. Anterior uveitis, non-granulomatous type, may be associated with it. Next question. Most important kidney function test which correlates with development and progression of diabetic retinopathy. Option A, UACR and EGFR. Option B, serum urea and creatinine. Option C, BUN. And option D, microalbuminuria. Time starts now. And here is the answer. Answer is UACR and EGFR. So actually, predictive efficacy of urinary to serum albumin to creatinine ratio is very high as against traditional biomarkers such as SACR or UACR alone in evaluating DR. Lower levels of EGFR are associated with progression of DR, but not with development of DME. We can move on to next question. So, fifth question is a 15-year-old obese diabetic male with sensory neural hearing loss had central vision loss in early childhood. He is suffering from autosomal recessive disease, which presents with multi-organ dysfunction, including renal failure and dilated cardiomyopathy, but a very remarkable normal intelligence. So, he is suffering from option A, Alstrom-Hallgren syndrome, option B, Bardet-Biedl syndrome, option C, Lawrence-Moon syndrome, and option D, retinitis pigmentosa. Your time starts now. So the answer is A, Alstrom-Hallgren syndrome. Actually, Alstrom-Hallgren syndrome is an autosomal recessive disease which presents with multiple organ dysfunction, but has a remarkable normal intelligence these patients have, and they present in very early childhood as obesity, diabetes mellitus, or sensory neural hearing loss. So now I would like to introduce our next quiz master, Dr. Purvi Bhagat. I really feel honored to introduce ma'am. She's a professor and head of glaucoma clinic, MNJ WRIU Ahmedabad. She has many publications and presentations in her kitty. She has international fellowship in medical education from FIMAR, CMC Ludhiana, and Philadelphia, USA. She's also an ambassador and committee member of FIMAR Connect. She was the honorary FICO Award winner by selection in 2025. She has various prestigious leadership positions she owns at local, state, and national facilities, societies, and committees, and is also in many editorial boards of many reputed journals. She had many awards to be, there are really numerous awards. To just shorten it, she was outstanding work as a woman award she got in 2015, and lately she has got the Distinguished Opthal Professor of India Award in 2025. So I welcome Dr. Purvi Bhagat, ma'am.
Thank you, Dr. Archana. Yeah. So moving on to the rapid fire round. Yes. And firing is the buzzword these days. So let's move on with some academic firing also. Could I have the slides, please?
Yes, ma'am. Ma'am, the team one is Team Drusen.
Okay.
Can you please?
All set, team one, true sense? Okay. So we'll be displaying the questions at one go. And you can try to attempt all of them in the limited amount of time that you have. I think it's 30 seconds, right, Dr. Shilpi?
Yes, ma'am.
Yeah.
Introduce yourself so that we can know you and we can also hear you, whether we can hear your answers or not.
Good evening, ma'am. I'm Dr. Chashin Ramu.
I'm Dr. Mohan Prasad. We are PGJRs in AIMS Raipur.
Okay. Mr. Sai, is it possible to pin them? We could have a better connect maybe.
Yeah, madam, I can do that.
Yeah, thank you.
And just a suggestion, be closer to the mic. And if you are answering any question, just let us know which question number you are answering. Okay?
Yes, ma'am.
Yes, ma'am.
So shall we
As far
start?
as possible, try to keep the same
Ah.
order, but nevertheless, you can choose any other order if you want, but we prefer that you go sequentially. And if you are not sure of any answer, you can quickly say pass, and then if you have time left with you, maybe you can come back to that question and try attempting it. Okay, but do remember that this session, this one has negative marking also. Okay, so just be careful of that. Okay, shall we get set and go?
Yes, ma'am.
Yeah,
Okay.
okay. So
So-
team one, this is the set for you.
So your time starts now. Ma'am, you can read the question.
Yeah. Which optical phenomenon causes a mirage? What is the wavelength of the UV light used in collagen cross-linking? What is the hallmark fundus finding in acute uveitic stage of VKH? Which enzyme is responsible for the metabolism of sorbitol and diabetic cataract formation? And what is the scientific name of silicon oil?
Hallmark of
We can't hear you.
Then did you all attempt to answer anything? We could not hear you.
No, ma'am. It's
No, ma'am.
time up.
Time up,
Time's up
ma'am.
already.
You want
Yeah.
to answer any?
Hallmark fundus finding in acute uveitic stage.
Ma'am, question number 3, sunset glow.
For acute uveitic stage में
I think we'll have to let it go. You cannot discuss so much
ma'am.
and take that time. Yeah.
So no
Maybe
question.
I think we can skip reading myself reading the questions, because that might distract them from reading and trying to answer.
Okay. Okay,
If
ma'am.
that's okay. Yeah,
Yes.
yeah. We can just display, you can read and you can attempt.
Okay, ma'am. Sure.
So team one does not get any marks. It's 0 for them for true sense. So the optical phenomenon which causes a mirage is refraction, which causes the false image formation at the observer's level. The wavelength of UV light, which is used in collagen cross-linking for corneal ectasia and keratoconus, is 370 nanometers. The hallmark fundus finding in acute uveitic stage of VKH, the Koyanagi-Harada syndrome, it is multifocal choroiditis with exudative multiple serous retinal detachments. Okay, it is a bilateral granulomatous disease which causes pan-uveitis, but in the acute uveitis, it causes multiple exudative detachments. The enzyme responsible for the metabolism of sorbitol in diabetic cataract formation is aldose reductase. And silicon oil, chemically, it is a liquid polymerized siloxane, and it is known as the polydimethyl siloxane. Okay, that is the scientific chemical name for silicon oil, which we use in retinal surgery. Okay. Yeah.
So the next
Thank you.
is team tomorrow.
Yes, ma'am.
Yes,
Here,
ma'am.
here.
Please
Yeah.
introduce yourself.
Ma'am, myself, Dr. Shabsan Mohammed, and I'm from Arvind Eye Hospital, Coimbatore.
Ma'am, myself, Dr. Narendra Raja. I'm from Arvind Eye Hospital, Coimbatore.
Which area residence?
Ma'am, first year residents.
First year, ma'am.
Great.
Okay. So all the best, team 2 tomorrow, but you'll have to answer the questions today and right now. Okay, you don't have time till tomorrow. So
Okay.
you can have the display of questions, and I'll not read them out so that not to distract you. You can just read and start answering right away.
Okay. So your time starts now.
This is some identification plot by DF of thermos. Ma'am, the first answer is 20x. A conical reflection seen in the nasal cone is a pain clear issue in the temple of conical.
Rizuti's test. The second one is Rizuti. At fourth,
Bacillus, ma'am. 3 is bacillus. 3 is bacillus.
Okay, that was incorrect. So your time is up. So for the first one, the magnification provided by a direct ophthalmoscope is not 20 times, it is 15 times. So you get a -5 for that. And Rizuti sign, yes, you answered that correctly. The third one also you get a -5. The string of pearls appearance is because of those discrete areas of fungal abscess balls, which are linked with vitreous strands and which are caused by candida. Okay, these are fungal abscess balls linked by vitreous strands. For the fourth one, the retinal layer, which has the split in retinoxesis, is nerve fiber layer. And the enzyme which is inhibited by therapeutic corticosteroids is phospholipase A2. So you get +2 for the second one and -5 for first and third.
It is
So that brings you to 0.
0. Okay. So the team 3 is team ZZ. ZZ. From Bhopal.
Yes,
Are-
ma'am.
Yes. Please introduce yourself.
Ma'am, myself, Dr. Lokesh from RKDF Medical College, second year resident.
You're the only one in the team?
Ma'am, second one is Vartika. Actually, I'm in the DRP posting, so we are logging from 2 devices. I guess she is not able to.
Okay.
Okay. So you will be answering on behalf of the team, right?
Yes, ma'am.
Okay.
Okay. So team 3, all the best to you, Lokesh.
And your time starts now.
Now.
Optical power of the human cornea is plus 44 diopters. Headlight in the fog appearance. Lesh nodules is neurofibromatosis.
Which type?
Neurofibromatosis type 1.
Okay. Time is up.
Yes, so for the first one, the only cartilaginous structure found in a normal orbit is the trochlea. It's a pulley-like structure through which the tendon of the superior oblique passes. The optical power is around 43 diopters. You said 44, so I think we can grant that to you. So +10 for that. Headlight in the fog appearance, which is seen in posterior uveitis, is by toxoplasma gondii, right? There are focal lesions, the chorioretinal layer, and which are obscured by the vitritis that is there. So it's a combination of chorioretinitis as well as vitritis, which causes the headlight in the fog appearance. Leash nodules, correctly, neurofibromatosis type 1, so +10 for that. And the presence of subhyaloid hemorrhage or vitreous hemorrhage. In presence of subarachnoid hemorrhage, it is known as Terson syndrome. Okay. So you get +20.
Yes. So team 4, Kirthana Pavan. Are you there? Team 4.
She's no. I don't think so. She's joined, madam.
Actually, when we call them, they said that they have joined. Okay. Then we move on to the next team. Next team is Team Bark. Team Bark.
Hello, good evening, ma'am.
Good evening.
Please introduce yourself. Yeah.
Ma'am, I'm Dr. Shruti.
I'm Dr. Pooja Rathod.
We are residents from BARC Hospital, Mumbai.
Okay. All the best to you, girls.
Thank you.
And let's have the set of questions, please.
So your time starts now.
Second answer is specular microscopy. Propionibacterium for third question. And
sorry, your time is up. Can we have the answers, please? So the image size difference in a person who has spectacle corrected anisometry of 3 diopters is 6%. For every single diopter, there is an image difference of 2% change, right? So that is known as anisoconia. So if there is a difference of 3 diopters, it would be 6%. Specular microscopy is incorrect. We are talking of the slit lamp examination. So the technique is specular reflection, okay? when the illumination and the observer's tubes, they are at equal angles on the corneal surface, but they are opposite to each other. It allows you the corneal endothelium assessment. It causes a diffuse specular appearance. So that is specular reflection. So that's -5. The bacterium that is correct, it's Propionibacterium, also known as Cutibacterium acnes. The hallmark clinical sign of retinoblastoma, it is leukocoria. And all of you know the differential diagnosis of leukocoria that you have to learn, right? And the wavelength of light which is used in SLT is 532 nanometers. It is a double frequency YAG laser, which is used for selective laser trabeculoplasty. So you get +10 and -5. So that makes it +5.
Right.
Thank you.
So next team is Team 6. Team 6 from Basaveshwar Medical College. Have you joined?
No, madam, they have not joined.
Okay. So next is Team 7, also not joined. Team 8, Phacomophos. Team 8.
They were there, I think we had read their name.
Yes, yes, I saw them. Team 8, are you there?
Cannot see them now in the participant list. Maybe they logged out or something.
Okay. Team 9, friends. Team 9.
Team 9 is their friends. Yes.
Hello. Good evening, ma'am.
Good evening.
Ma'am, actually, I am Dr. Gaurav. My teammate is Dr. Samvida. Actually, we both are in different cities right now. So she has joined from a different login. And both of us can speak or only one of us have to speak?
We need one answer.
Okay. From the same person, right?
I mean, anyone.
No, both of you can participate, but just ensure that there are no conflicting answers and
Okay.
there should be no confusion between the two of you. We should get a clear one answer.
Okay. Thank you, ma'am. Thank you. Ma'am, both of us will be logging.
Okay. Okay. So please introduce
Can
yourself.
we have?
Yes, ma'am. I am Dr. Gaurav Pandey from IOBHU, ma'am.
The other partner?
Yes, ma'am.
She is muted.
Just a second, ma'am. Sorry. Hello.
Is she having any problem getting unmuted or? Mr. Sai, if you could please help her, can you unmute from your end?
Ma'am, she's not able to unmute the.
What is the name of your team?
Team 9 friends.
She's unmuted now.
She's unmuted already.
Just quickly talk to her if she is having some issues.
Yes, ma'am. Till then,
Yeah.
Team 6 can go if they have come joined in.
Okay. Team 10.
Team 4 is joined now, madam.
Team 4. So we'll play with Team 4. Kirtana Pawan?
Ma'am.
Yes. Please introduce yourself.
Myself, Pavani from Jipman, ma'am. She is my friend, Kirtana. We are second from Jipman. We are from second year residence, ma'am.
Great. So you know the rules and everything?
Yes, ma'am.
Okay, so shall we start?
Okay, ma'am.
So your time starts now.
Two is ripacidil, ma'am.
Rokinase inhibitor. Fourth is
Which group of viruses are? Third one is HSV, herpes virus, ma'am.
Herpes simplex. Fourth one is
Hutchinson sign, ma'am.
The last one?
I'm not sure.
Okay.
Okay.
Let's see
So
the
done a good job overall, team 4. So far point or punctum remotum is basically the farthest distance at which an object can be seen clearly without any accommodation, right? Without any efforts. So if the far point is virtual, that is behind the retina, it is hypermetropia. You corrected yourself right in time that it's ROCK inhibitors. We asked for a group of drugs. So it is Rho kinase inhibitors or ROCK inhibitors, and netarsodil causes that characteristic honeycomb type of a corneal edema, and it causes decrease in vision, but fortunately it's reversible on withdrawal of the drug. Acute retinal necrosis, yes, it is most commonly caused by herpes simplex virus. Hutchinson sign, again correct. It is mainly because of involvement of the nasociliary nerve, the branch of the maxillary nerve, because of the involvement of it supplies both. It supplies the nose also and the eyes also. And the ardent ratio is the ratio of maximum light peak and the minimum dark trough. So the normal ratio is 1.8. So anything greater than that is normal, and anything less than that is subnormal or abnormal, and which suggests some RP dysfunction. So you get plus 30 plus 10 into 3, so plus 30 marks.
Thank you. Team 9, are you able to unmute yourself?
Hello, yes, ma'am. Ma'am, my partner is actually, she's not able to log in. Actually, probably the screen, they have asked them to only log in from one or something. She's in the webinar, but she's not able to.
Will you answer alone?
Hello?
Will you answer
Can
alone?
Yeah, do you want to attempt alone?
Yes, ma'am, no problem. Okay, ma'am.
Okay. So, you'll have to introduce Dr. Rohit Saxena.
Yeah. So it's a pleasure to introduce Dr. Rohit Saxena. He is a professor at the RP Center at AIIMS, New Delhi, and he specializes mainly in pediatric ophthalmology and strabismus and neuro-ophthalmology. He has done his undergrad and postgrad both from AIIMS, also done his PhD from AIIMS, and is also an honorary FICO from the AIUS. Has multiple publications and also the editor of 3 books and an invited faculty in national and international conferences of various levels and fora. And he has also performed live squint surgeries in many conferences and is a recipient of multiple national and international conferences. Thank you.
Ma'am, if sir joins, can you please take over his questions on his behalf?
Yeah, sure. I'll do that. Okay.
So, team friends.
Yes, ma'am.
Okay. So, your time starts now.
First observation.
First, ma'am, observation.
Second का LOX.
Second is LOX gene.
Third,
fourth is for
myasthenia.
myasthenia gravis. Band shape keratopathy is calcium deposit.
Calcium deposit.
Third pass, ma'am, rest.
Good job. The first team to attempt all the questions in time.
Not only that, you coordinated very well with your partner on phone.
Thank
That's
you.
nice. Yeah. So the treatment of choice for acute CSCR is observation. That was correct. The mutations with pseudoexfoliation syndrome, they are the LOX L1 gene. That is also correct. The Yokohama procedure is used for treatment of myopic strabismus fixus. And again, right for myasthenia gravis, the Kogan's slit twitch sign, it is seen in myasthenia. And the band-shaped keratopathy on the cornea, it is characterized by deposition of calcium. Right? And you can see it in the interpalpebral area, and it is significantly affects the visual acuity as well as the quality of vision. Right. So we have 3 correct. One,
Plus
2, and
correct.
fifth one.
Fourth. No, ma'am.
And
One,
fourth one. Yeah.
and fifth.
1,
So
2, and
four correct. 40.
Correct.
plus 40. Plus 40.
Yes, ma'am.
Thank you, ma'am.
Welcome. I think team 6 have joined. Team 6. Please unmute.
Yes, ma'am, we have joined.
Please introduce yourself.
Ma'am, I'm Dr. Priyanka. I'm first year resident from Basveshwar Medical College, Gulbarga.
I'm Dr. Bindushri, first year resident from Basveshwar Hospital, Gulbarga.
So all the best to you guessers.
Yes,
We
ma'am.
hope all your guesses are correct and fetch you plus 50. All the best to you.
Thank you, ma'am.
It's good to see the first year students taking part in.
Yeah.
Yeah.
I'm
Okay.
just glad I'm not participating and I'm on the other side of the bench. Please, can
Okay.
we have the set of
Yes,
questions?
ma'am. So ready, team 6?
Yes, ma'am.
So your time starts now.
Time is running. Start answering if you know any of them. So sorry, your time is up and you could not attempt any of them. So that's a 0 for you. Can we have all the answers, please? So HLA-29 mutation is associated with birdshot chorioretinopathy. The drug of choice for treatment of malignant glaucoma is atropine, because we want the irido-lenticulociliary diaphragm to be pushed posteriorly, the AC to be formed, and we want the reversal of the aqueous misdirection. The stereoacuity test, which is based on the anaglyph principle, is the TNO test. Teprotumumab is used in the treatment of thyroid eye disease. Okay, that's one of the newer drugs that has come up. And Lester-Jones tube is used in conjunctival DCR. Okay, so those were the answers. You still have other sessions to catch up, so all the best for the other sessions.
So
Next
the
team.
next team is team 10. Team 10 Oculus expert.
Hello, good evening, ma'am. Are
Good
we
evening.
audible?
Yes, you're audible. Please
I am,
introduce yourself.
yes, I am Dr. Ahan and she is Dr. Pooja. We are final year postgraduates from Jaipur.
Okay. So are you
Okay,
both ready?
so
Are you ready?
Yes, ma'am.
So your time
all the
starts.
best to you experts. Yeah.
One is congenital stationary night blindness. 2 is porcine. 3 is PPCD. Parapontine reticular formation for 4 and medial rectus for 5.
I give you 5 seconds. I just want the name of the disease for the first answer. It's congenital stationary blindness is a very wide term.
Oguchi's disease.
So the answers?
First one is Oguchi's disease. So you needed to be more specific for that. Zengel is made up of porcine gelatin. Okay, that is again more specific. Hammered silver appearance is seen in ICE syndrome, iridocorneal endothelial syndrome. The center for control of horizontal eye gaze is the parapontine reticular formation. And the muscle which has the shortest length, the extraocular muscle, that is the inferior oblique. Okay, so those were the answers.
So first
Maybe
is
for 1 and 2.
2 is
PPRF.
We give them 3 also. Sorry, fourth one.
Fourth
So,
one.
3 correct and 2 wrong. So it comes out to be plus 20.
Thank you.
And just a small tip for your exams, especially since you are like third years, do not use any abbreviations. Okay, always go for the expanded forms, the full names. Don't say PPRF in exams. Okay? Always use the full forms.
Thank you.
So the next team is Team 11, Morning Glory. Have you joined?
Yes, ma'am.
Okay. Please introduce yourself.
I'm Dr. Aishwarya from JSS Medical College, Mysore.
And your partner?
Due to some family emergency, she's out of town, so she couldn't join.
Okay, so you'll be attempting alone, right?
Yeah.
Okay, no problem. All the best to you. We'll have your set of questions.
Second is medial wall. Fourth is shine plug principle. Polyamide silk material for vehicles.
Yes, so the time is up. We'll see what the answers are. So hemorrhagic occlusive retinal vasculitis is often caused by intraocular injection of vancomycin whenever we give intravitreals. Most common wall of the orbit is the orbital floor fracture. Okay, that is the most common fracture. FOXC1 and PTEX2 mutations are associated with the Axenfeld-Rieger's syndrome, one of those anterior segment dysgenesis in childhood glaucomas. And this one was correct. Pentacam device is based on the Schimflug imaging. And the material of Vicryl is not polyamide, it is polyglactin. So for fourth, you get plus 10, but for the second and fifth, you get minus 5 each. So that brings you to 0. Is it right, Dr. Shilpi?
Yes, ma'am. Yes, ma'am.
Yeah. Okay.
Moving on to the next team, Team 12 from KMC Manipal.
Hello, good evening. I'm Dr. Samyak Kalamkar from Kasturba Medical College, Manipal.
I'm Dr. Anjana. We are third year PGs.
I just wanted to ask the meaning of your team name. Does it have a specific meaning or it's just the general Hindi word?
No, it's like Samyak plus Anjana. So we
Acha, okay.
like that.
That is nice. Okay, so hope you understand both of you the questions as well as each other well. So can we have this set of questions?
Yes.
Fourth is exophthalmometry for
Please.
So your time is up. Let's see what the questions are. Unfortunately, you could not attempt a lot. So ferricimab acts on the angiopoietin 2 and the VEGF-A. It's an anti-VEGF drug. The anti-epileptic drug, which causes visual field defects, it is vigabatrin. This is, you can say, a basic question. The serpentine ulcers, they are caused by pneumococcus, classical serpiginous fashion in the cornea, gradually involving the whole of the cornea. And Navziger's method is for proptosis. And the cataract in galactosemia occurs mainly because of collection of galactitol. So those were the answers.
What about the fourth answer?
So fourth one, I think we can give that to them. Exophthalmometry basically is for proptosis.
Okay, ma'am.
So plus 10.
Yes. So with this, we end with the 10 teams in rapid fire round. And now it's time for the MCQ set 2 by Dr. Archana Kumari.
Yeah. So the team's ready for the MCQ set 2. Questions, please. Yeah, so ICROP 3 had following updates except option A, zone of the ROP was defined secondary to notch. Option B, posterior zone 2 was defined. Option C, new term AP-ROP was defined. And option D, regression was defined. Your time starts now. So the answer is new term AP-ROP was defined is false. ICROP 3 said that the zone of the ROP was defined secondary to the notch. There was posterior zone 2 was defined in ICROP 3. New term AROP was defined and regression was defined. Next question. Which Leaford fracture most likely will involve nasal bone? Option A, Leaford 1. Option B, Leaford 2. Option 3, C, Leaford 3. And option D, Leaford 2 and 3. Your time starts now. So the answer is option D. And a very brief explanation, Leaford 2 and 3, as it is very evident, can involve the nasal bone. However, Leaford 1 doesn't. Next slide, please. Yeah, a 55-year-old male presented with inferonasal field defect and given fundus finding. The true statement is option A, it is common in hyperopics. Option B, it always needs surgical intervention. Option C, never extends posterior to equator. And option D, it causes relative scotoma. Your time starts now. And the answer is that the true statement, it is common in hyperopics. So retinoschisis is usually inferotemporal but can be superotemporal. It is common in hyperopics and rarely needs surgical intervention. Reticular form does extend posterior to equator also, and it almost always causes a well-demarcated absolute scotoma. Next question, congenital X-linked retinoschisis needs vitreoretinal surgery for all of these except option A, dense non-clearing vitreous hemorrhage. Option B, dislocated cataract in vitreous cavity. Option C, overhanging wall of sciatic cavity obscuring macula. And the last option is macula-threatening retinoschisis. So your time starts now. So the answer is B, dislocated cataract in vitreous cavity. Dislocated cataract is very unusual in congenital X-linked retinoschisis. Next slide. Regarding Behçet's disease, true is option A, it's always bilateral, non-granulomatous uveitis. Option B, diminution of vision is mainly due to dense vitritis. Option C, it's seen in immunocompromised males. And option D, it gives a starry sky appearance in fundus fluorescent angiography. Your time starts now. So the answer is A, it's always bilateral, non-granulomatous uveitis. So we all know Behçet's is always bilateral non-granulomatous uveitis. Diminution of vision is mainly due to CME. It is seen in males, and starry sky appearance is seen in FFA of BKH and SO. Next slide.
So with this, we end with the second set of MCQ round. Thank you, ma'am. So it's time for the commercial break. A small promotional video from His Highness team. So once again, thank you, His Highness team. So now it's again time for the rapid fire round. So we'll play the rapid fire round with the remaining teams. So the next team, team 11, is team 13 from KR Hospital, Mysore. Team 13?
13 is there. Yeah,
Yes.
we can see them. Team 13. Some number is there.
Yes.
Please switch on your video. Team
You need to
13.
turn on your cameras and also unmute yourself.
We are having some issue on that. Hello, ma'am.
Yes.
Audible. Ma'am, can you hear us?
Yes, yes, we can be.
Our video is not getting turned on.
Please introduce yourself.
Can you hear us? Team 13.
Sai, can you please help them? Till that time, we'll move on to the next team. That is team 14. They then join. Team 15.
Yes, ma'am.
Yes, please introduce yourself, team 15.
Ma'am, myself, Dr. Akshika, Dr. SN Medical College, third year resident.
Myself, Dr. Vinish, third year resident, SN Medical College, Jodhpur.
Okay. And your partner?
Both are there.
I'm Dr. Vinish Sharma, third year resident, SN Medical College, Jodhpur.
Okay, Jodhpur rights. So all the best to you for this set of rapid fire.
Thank you, ma'am.
That's now.
Ma'am, fifth, Gancyclovir.
Your time is up and you could attempt only one out of those 5. So we'll see what the answers are. So the volume of a typical eye drop is only 50 microliters or 0.05 ml. Okay. So you have to be very careful when you instill an eye drop or ask the patient to instill an eye drop. If they instill more than one drop, it is very likely to overflow, right? Because the conjunctival sac will not accommodate more. The thinnest part of the sclera, it is just behind the insertion of the recti muscles. Silent choroid is a feature of Stargardt's disease. Okay, silent choroid is basically a feature of fundus fluorescent angiography. So in the early phases, because of the lipofuscin pigment which is there is an early blockage of that early choroidal fluorescence. That early choroidal fluorescence will not be seen. So that is why it is known as a silent choroid. The most common location of metastasis is in uveal melanoma is the liver. It does metastasize to other parts of the body like the lungs, bone, and the skin. And once the metastasis is there, overall prognosis is very poor. The most common site for the metastasis is the liver. And the fifth one was right. That is intravitreal depot formation in the form of an implant used in CME retinitis is Ganciclovir. Right? So you get plus 10 for that last one.
Yes, ma'am.
Yeah.
So the next team is team 16 from Nair Hospital, Mumbai.
Good evening, ma'am. This is Dr. Madhav, third year resident from Nair Hospital.
Good evening. I am Dr. Raman, third year resident at Nair Hospital.
Okay. All the best to you, boys. So can we have their set of
Are we
questions,
audible?
please?
Thank you, ma'am. Thank you.
Yes, yes.
Second, iris means grapes.
Answer 1, Michelson interferometry
Snow-
based on partial coherence of light.
Snowflake cataract associated with diabetes.
Middle wall fracture, answer 4. Word iris.
Okay, so you
But you
attempted a fair amount of questions.
But what is the what you answer for the first question?
Michelson's interferometry. It uses partial coherence interferometry of the light.
Yeah, so the answer for that first one is right. It's low coherence interferometry. Low coherence basically because the wavelength that they use is low coherent. So it allows for the calculation and measurement of the time delays that happen. And interferometry basically because the light that is sent to the tissues, it basically takes up two pathways. So one reaches the reference mirror and one reaches the tissues. And then they again meet each other and interfere with each other. So the time lag that happens between the reflections from both the sides, that gives you the tissue density and depth. Okay. The original meaning of the word iris is rainbow. Okay. This one was correct. Snowflake cataract is commonly associated with diabetes mellitus, especially with insulin-dependent diabetes mellitus. It is more common, type 1. This question was already discussed first. You missed out on this. It's the blowout fracture or the orbital floor fracture. It's not the medial wall. The most common is the orbital floor fracture. And the systemic condition which is commonly associated with floppy eyelid syndrome is sleep apnea.
Hello.
Okay, floppy eyelids is
So
basically
I'm
when
not
the
able to
patients
go on the video.
are resting or sleeping, the upper eyelids, they flop up, they are very lax, and so they get everted. Okay? And this is mainly because of loss of elastin, which happens because of oxygen deprivation, which happens in obstructive sleep apnea. Okay? So for the first one and the third one.
Yes. Ma'am, what about the second? I think grapes is also the right answer. I'm not sure.
Iris is actually multiple colors. It's a literal meaning is rainbow.
So plus 10 to them.
Yeah. Plus 10 for the first one and plus 10 for the third one.
And
So
then
plus
minus
20.
5, minus 5.
And minus 5, yes.
Yes. So, okay. So the next team is team 17. Team 17.
Cannot see team 17.
Team 13, is your issue resolved?
Video is still not getting turning on.
But can you hear us?
Yes, ma'am.
Okay. Let's start with you. You can introduce yourself.
Yes, ma'am. I am Vishnu Pooja. I am Dr. Sneha. We are from Government Medical College, Mysore.
Okay. So.
Okay. All the best to you girls. Let's have
Thank
your
you.
set of questions.
Second one, ninth layer. Which layer of retina? Third one is flat iris. Second one is the second element. Fifth, level.
I'm sorry, your time is up, and you get a -5 for the wrong answer, and ninth is absolutely not an acceptable answer. You have to actually name that layer. Okay. So, which rare type of color vision commonly seen in women? It allows people to see more colors. It is tetrachromacy. Basically, normally most of the population have three types of cones. That is for the red, green, and blue. But some amount of the people, especially women, they have a variant of the red cone also, and because of which all of us, females, have those multiple shades of violet, and we have multiple shades of red, and all those extra perception of colors which the males cannot appreciate. So that is known as tetrachromacy. The layer of the retina which contains the photoreceptors is the outer nuclear. The hallmark of plateau iris and gonioscopy is a double hump sign, also known as a sine wave sign. So basically those two humps are, one is because of the surface of the lens, anterior surface, and the peripheral hump, which is towards the angle, it is because of the anteriorly rotated ciliary body, right? So that causes the angle closure, and it causes the typical double hump sign or a sine wave sign. The most common second malignancy in survivors of retinoblastoma is osteosarcoma, and it is more common with the hereditary variant of the retinoblastoma. And in congenital nasolacrimal duct obstruction, the obstruction is at the level of the valve of Hasner, so which opens at the level of inferior meatus. So in congenital cases, sometimes it can be partially covered with a membrane or completely covered with a membrane, which leads to the duct obstruction. So you get -5 for the third one. And should we give a -5 for the second one also? Or we can let them go?
Let them go.
Okay.
Okay. So the next team is team 18. Team 18, pseudopedia. Kavya S.
Yes, ma'am, we are here.
Kavya S, no?
Not come. Yeah, the video. We have unmuted and we have on the video, but we are not visible in the.
We can see you.
Okay. Oh, we can.
It's Kavya S, yes?
Yes, ma'am. Kavya and Hamna from Shankara Hospital, Coimbatore. Hello, ma'am.
Okay, Kavya. Yeah, Kavya. And your partner?
I'm Hamna. We both from Shankara Hospital, Coimbatore.
Okay. So all the best to both the pseudophakic girls. Yeah.
Thank
Can
you,
we
ma'am.
have their set of questions?
Yes. Your time starts now.
Oh my God. First was cholesterol. Yes, cholesterol. Second one, so cholesterol. Oh, this is that laser thing, no? Common characteristic finding in retinitis pigmentosa. In the bony thickness that class of intraocular lens implant, which is customization of the
You're discussing too much and answering nothing.
So 2 is the cholesterol, 5 is the pale disc. No,
disc,
bony spicules, and
No.
one.
Sorry, your time is up. You're way beyond your time, actually. So the bones which form the superior orbital fissure, they are the lesser and greater wings of the sphenoid bone. Hollenhaus plaque, yes, that you answered correctly. +10 for that. Cholesterol. Basically, these are very fine microscopic cholesterol emboli in the retinal vessels, and they usually are seen at the bifurcations of the retinal arterioles. So sometimes they may cause transient visual obscurations, or sometimes it can lead to permanent vascular occlusions also. The patients with significant visual loss, when they complain of vivid visual hallucinations, it is known as Charles Bonnet syndrome, also known as phantom vision. Just like they have the phantom's limb in the eye, it is the phantom vision. Basically, it is the brain's adaptation process to visual loss that has occurred. And this very commonly seen in ARMD and in cases of glaucoma, irrespective of what their vision is. the intraocular lens implant, which permits customization of the refractive outcome after implantation, is light adjustable lens. So once these IOLs are implanted and there is a refractive surprise post-operatively using ultraviolet light, because of the material that is there, the power of that IOL can be modified to compensate for that refractive surprise. And the most characteristic fundus finding in retinitis pigmentosa is bony spicules. Okay. And the other findings, as you said, are waxy paler disc and retinal arterial attenuation. But the hallmark is bony spicule formation.
So it's plus 10 and
So,
minus 5.
yeah, -5.
Plus 5 total.
Yeah.
Sai, can you please help the Theos team? They have messaged me that they're trying multiple times, but they are unable to log in. I mean, they are.
We'll
Yeah.
speak to them.
Yeah. So the next team is team 19. Team 19, the Sadaf focus finders.
Good evening, ma'am. I think the video is not visible.
We can see you.
Okay. I'm Dr. Sadaf. I'm from SSMC Riva.
I am Dr. Ankur from SSMC Riva.
Which year
Okay,
student?
all the best to you. Yeah.
Thank you. Thank you.
Thank you.
You're from which year?
Second year.
Second year.
Second year.
Okay. Chalo. All the best. Your time starts now.
Thank you.
Trachoma, I guess.
Trachoma.
Which considered ADs cataract. Trauma. Less than 2 years. Hold on.
Brinzolamide.
Brinzolamide.
Dorzolamide, brinzolamide.
Sorry, our time is up. So we'll see what the answers are. So the infective disease affecting the eye, yes, you rightly said it's trachoma. On 8th October 2024, the WHO declared that India had eliminated trachoma as a public health problem. Beta carotene is the constituent of the AREDS formula, age-related eye disease system. It is contraindicated in smokers, and that is why they had to come up with the AREDS 2 formula. And this basically is contraindicated in smokers because it increases the risk of lung cancer in current or past smokers. So they had to exclude beta carotene from the AREDS 2 formula and design a new formula comprising of lutein and zeaxanthin in place of beta carotene. Myotonic dystrophy is the condition which is classically associated with Christmas tree type of a cataract, which has those polychromatic, multicolored, needle-shaped subcapsular changes. And the topical glaucoma medication is not brinzolamide, it is brimonidine. Okay, and it is contraindicated in children less than 2 years because of the sleep apnea and CNS depression it causes. So less than 2 years strictly not to be given, and 2 to 6 years to be given with monitoring and with great caution. Okay, because it is a CNS depressant and it causes apnea also. And the normal value of stereo acuity measured is 40 to 60 seconds of arc. So you get plus 10 for the first one and minus 5 for the fourth one.
Plus 5.
Yeah,
Okay.
plus 5.
Team 17, have you joined, Theos?
We have a technical issue in the device, madam. I've asked them to log in with an alternate device.
Okay. And team 20, are you there? Ayushi Apurva. Team 20? No. Okay. And team Phacomorphos, team 8. You initially joined, so are you there? Any of the teams remaining?
Madam, there's a confusion between team 6 and team 9.
That I have already spoke with. Hai na? So team 9 is friends.
Team 6 and team 9, you can log in
Team
and
9 is friends, ma'am. Yes, ma'am.
Team 9 is friends. Hai na? You played individually. Your other
Yes, ma'am.
participants on phone.
Yes, ma'am. Yes, ma'am.
Okay. So any team remaining for the rapid fire round? Okay. So, ma'am, I think 5 teams, they haven't logged in. So I'll stop sharing the screen. We'll play with the rest of the MCQ round now.
Yeah, sure.
Hello, am I audible?
Yes, ma'am. Is my screen visible?
Yeah.
So let's move on with the third set of MCQ round. Dr. Archana, ma'am.
Yes. Please, let's proceed. Regarding both side pros device, false statement is option A. Indication includes ocular chronic graft versus host disease, Steven-Johnson syndrome, and corneal ectasia. Option B. Customized scleral lenses. Option C. Pros lenses are made of rigid gas permeable fluorosilicate acrylate polymer. And option D. In long term, they may result in disease reversal. Your time starts now. So the answer is, the false statement is, in long term, it may result in disease reversal. So PROS devices support the primary functions of the ocular surface and cornea and are made up of rigid gas permeable silicon, and it is indicated in broad range of complex corneal disease like OSD, GV, HD, but PROS treatment offers continued benefit, no disease reversal. Next slide. So visual snow syndrome have all these associated symptoms except number 1, palinopsia, number 2, cutaneous allodynia, number 3, hyperacusis, and number 4 is trigeminal neuralgia. Your time starts now. So visual snow syndrome is not associated with trigeminal neuralgia. Visual snow syndrome is an enigmatic, intriguing, bothersome, typically non-progressive visual perception and a neurological abnormality characterized by a pixelated array of dynamic visual noise. It is associated with many phenomena like hyperacusis, photopsia, migraine, phonophobia, but is not associated with trigeminal neuralgia per se. Next slide. True about this OCT picture. A. It is a multi-layered PED and has no correlation to number of anti-VEGF injections given to the eye. Option B. It is a type 1 CNVM. Option C. Prechoroidal clefts are never associated with these PEDs. And the last option is usually have very poor visual prognosis and high chance of RP tear. Your time starts now. So this is a type 1 CNVM. It is actually a multi-layered PED, but it is associated with multiple anti-VEGF injections and prechoroidal clefts also, which results from horizontal contractions of the PED. It is a type 1 CNVM and generally have good visual acuity and less chances of high-grade RP tear. Which of the following statement regarding Fuchs heterochromatic iridocyclitis is false? Option A, cataract surgery may result in hyphema in AC on entry. Option B, usually associated with posterior subcapsular cataract. Option C, needs urgent and aggressive treatment of vitritis. And the last option is, it is characterized by stellate capies. Your time starts now. So the false statement is that it needs urgent and aggressive treatment for vitritis. Fuchs heterochromatic iridocyclitis, it causes Amsler's sign, that is hyphema on entry into the eye, and is associated with vitritis, but that doesn't need treatment usually, and it is associated with stellate capies. So the last question is regarding dome-shaped maculopathy. True is option A, occurs only in myopes. Option B is always bilateral. Option C, clinical diagnosis. And option D, most common complication is subretinal fluid. Your time starts now. So the answer is most common complication is subretinal fluid. So we know that dome-shaped maculopathy is actually a OCT diagnosis. It occurs in mostly in high myopes, and may be noted with hyperopia or emetropia also. Most common complication of DSM is foveal subretinal fluid. So we are done for today.
Yes. So with this, we end our today's episode. So, Sai, is the problem resolved of the team number?
I asked them to log in on a different device. Theos, are you there?
Simran Sinha, we can see you. Simran Sinha. You messaged in the group that you are unable to log in. Okay. So let's move on. Thank you, Archana ma'am. Thank you, Purvi ma'am,
Thank
for
you.
this wonderful quiz. So I think it's time for interacting with the team. So all the teams, you can just switch on your videos, audios, and everything. Hannah? All teams.
I think they are not easily able to switch on the video, like I am not able.
Okay. So Purvi ma'am, you can interact with them. I mean, how is the today's quiz?
Yeah, maybe they can share their experience of how did they find the questions. Anybody would like to volunteer,
Anyone, come on.
irrespective of whatever marks they got. What was their experience of the set of questions we had designed?
Good evening, ma'am. I felt that
Yeah,
the
good evening.
questions were doable if we would have kept our minds calm and read the questions properly, given that there were no distractions. We were able to read, we had all the time. And they were really good, very informative, especially the explanations for all questions are very helpful to increase our knowledge. And I was very happy with the knowledge that I gained. Thank you.
That is a very important point that you said about all these quizzes and competitions. No, you need to keep your calm and cool and stay focused, because most of these questions I felt that they were kind of right out of your books and from your syllabus and curriculum. So nothing that was totally out of the blue and you would not have even heard of that. So maybe just a little bit of calm and focus might help you. Not all, but at least maybe you could all of you could score a little more than what you currently did. That's okay, but this is always a learning for us also as faculty. Whatever Dr. Archana was asking, I also was wondering whether I knew it, about whether what my answer would be correct, incorrect, and it was a learning for me also. So it's the same for everybody. Anybody else would like to share?
I'm sorry, I'll interrupt here. So these
Yeah.
are the top 3 private practitioners for today's quiz. So we ask them to please raise your hands or type in the chat box so that we can promote you as a panelist. So one is MOH in the last. The second position is by some BJ, and the last is KIU. So meanwhile, we teams, yes, you can share your experiences.
I felt, ma'am, all the rapid fire questions had the third question to be the most difficult of the 5.
I don't think that was planned, ma'am. Purvi ma'am, was it
not
planned?
planned.
Exactly.
No, not planned at all. That is incidental, but actually, a study has been done since you mentioned that if you consider any MCQs, most likely there are most chances that the option for them would be option C. That is the
Yes.
third one. Actually, a study has been done, but this again, it's incidental, but then it follows the same results of that study. So even if you don't know, if you answer C or option 3, it's likely to be correct. But that's a good observation. I'll check it again.
How about the MCQs? I tried to make it bit on the more higher than moderate.
Yes, ma'am. The first and the second round were good. Third was a bit key. We have to be had reading them in depth. So
Yeah, but actually these questions I designed in such a way like if you don't know much about the topic also, presence of mind also sometimes helps in these questions.
yes, ma'am. Few of the questions
Yeah.
were like that. Yes, ma'am.
Yeah. So you never have to be disheartened reading a big name.
And if you carefully observe, actually, much of it that was also incidental. They were quite overlapping also, like the MCQs and the rapid fire. In fact, that blowout
right.
fracture and
Blowout
yes,
fracture was repeated.
yes. So that is also, if you attend throughout, no, many of the answers you might just get from the question paper itself. That's
Yes,
also a possibility.
Also, if you will attend the other quizzes also, no, because whatever we do, there are likely chances that with the repeated episodes, no, there are likely chances that the questions will get repeated. Matlab, no one is so perfect that yes, the question will not be repeated.
Yeah, honestly, actually, if in a single quiz there's so many questions getting repeated, there is quite chances, matlab, chance means definitely probability favors it. That if one attends all the quiz, they will really, by the end of the whole quiz, they will really be able to answer it well.
Yes. So we have our private practitioner winners for today's episode. Q Mondal is our regular winner of the in the private practitioner group. So Archana ma'am.
Yes.
We have already so many times interacted with Dr. Q Mondal. So now it's your time to.
Okay. Dr. Mandal, you're really means maintaining up your academics
I'm
along with your
Dr.
private
Q Mandal from AIMS Raipur, senior resident.
Okay, very nice, very nice. So you're doing your because you're SR, so you're very fresher to your academics.
Yes. Just
Right.
1 year ago, I have passed.
Fabulous.
Thank you, ma'am.
Inspiring. All the other PGs should actually get inspired. We should be academically active even after our PG days.
Yes, ma'am. I was the previous round, I was the finalist in PG category.
Oh, there you are. That is why you're well prepared by attending all the quizzes, right, Q?
Yes. Thank you, ma'am.
Welcome. Keep
Well,
it up.
this is also brilliant, like Dr. Shilpi and Dr. Rachna, that on the same forum we have year ones also participating and SRs also all on the same platform. So that's
Yeah. And ma'am,
Nice
even I
initiative.
noticed that the first years they have performed well. They were on par. Means that's very good.
Yes, for JR1s, I mean, thinking of attending such quiz, really, man, you are not even in the flow of what is ophthalmology.
Actually, they're lost almost for the first 6 months.
And the other winner is Muhammad Clark. Yes. Hi, sir.
Good evening, ma'am.
Good evening. Congratulations, sir.
Thank you, ma'am. I am third year PD. I am third year postgraduate from Patna Medical College.
Okay. Sure. So, Purvi ma'am?
I think
Yeah,
I'm not
so
too much. Is not.
No, we can hear you.
you're audible. Yeah. So this has been your first participation, or you have been regularly participating?
I was in quarterfinal 2 in the previous episode also. This today I was in as an audience, playing as an audience.
Okay. So how do you find the difference participating in a team and participating as an audience?
As a team,
You're more relaxed as an audience.
As a team, it was very nervous to me. But today it was very cool. I'm just like an anonymous type.
Yeah.
As a team,
True.
they have to play this rapid fire round, na?
Previous
The
episode,
performance pressure is there, no?
very nervous.
And how did you find the questions, Dr. Akla?
It was very tricky. Like it was, I have to roll out the options for the MCQs. But the rapid fire was very good. Today's episode was very good. And that previous participant has said that we have to be calm and read the questions carefully so that we could answer it correctly. It was very well. Thank you, ma'am. It was very well informative.
Actually informative to us too. Actually, I also want to really, I say that Tulvi ma'am, it was really like very nice. I was trying to answer the questions as fast along with the participants.
Yeah.
Ma'am, what happens is when we are preparing the questions or anything, na, it's like, okay, there is no performance pressure, there is no time limit or anything.
Yeah.
Even though we know the answers, but it is really difficult for everyone to just in that stipulated time you have to answer.
Yes.
Honestly, and we realize that it's very lucky to be on the other side, being a quiz master.
No, if Mr. Size, that teddy bear timer is not there, no, then things would be totally different. The ticking of the timer, no, it is like it increases the stress level.
Timer is
Yeah,
not.
the adrenaline rush.
That's that what is you all will face.
Thank you, ma'am.
Okay, thank you.
And Dr.
Thank
Aklak,
you.
again, he has proved that, attending the quizzes and doing it again and again, you become
Yes.
so good. He was attending last all quizzes. He has attended this quiz and see.
I have also attended the previous year quiz also. I just
Yeah.
qualified for the quarter final previous time.
But you gain a lot of knowledge too along with it, right?
So
I
that's
think
what
I'm
we
not very
always
audible.
keep on telling ki it's not always for the prize or anything. It's
Yes.
just to increase our knowledge.
Yes. Sure. Thank you.
So
We
any
are
other?
on YouTube also, na, Dr. Shilpi? These all episodes.
Yes, ma'am. These episodes are on YouTube also.
So that's also like we can always
Go
let
back and
know. Yeah.
So any other team, any other suggestions or comments? I think most of them have logged out. Yes, ma'am. So thank you, ma'am. Thank you, Archana, ma'am, Purvi, ma'am.
Thank you.
Thank you. Thank you so much. It was
Thank
really
you.
fun and was as academically enriching.
So our next
Thank
quiz
you.
will be on 21st of May, Wednesday, at same time, that is 7:30 p.m. with new quiz masters and quarter final 4 teams. Okay. So till then, goodbye.
Thank
Good
you.
night.
Bye.
Good night.